Hello, I'm Marian Ryan, the District Attorney of Middlesex County. Thank you for tuning in to this episode of Middlesex Update. Today we're going to be talking about the opioid epidemic and how in our county, police departments, fire departments, and recovery specialists, as well as EMTs and other professionals, have partnered to create both innovative and data-driven programs to address these issues. To give you a sense of the scope of the problem, in 2017, state police assigned to my office responded to 222 fatal opioid overdoses across the county. That was, in fact, an 11.5% decline from 2016, and it represented the first decline in those numbers since 2013. Up north of our county, in our county, in the city of Lowell, which had for so long really been the epicenter of this epidemic for us, we ended 2017 with a 21.2% decline in fatal overdoses. That's obviously encouraging, but our work is by no means done. And we remain conscious, as we always are, that behind every one of those numbers, which is how we measure what's happening, is a family who loses a loved one, a son or daughter, brother or sister, and increasingly a mom or a dad. Now, before we get to the panel, I'd like to talk about a couple of new programs that we've begun in the office. The first of which is a new partnership begun in 2017 with Project Linus to provide blankets, which have been shown by research to be extraordinarily comforting to children of all ages. And we're providing those through our police and fire departments to kids across Middlesex County who may experience either an opioid-related or other type of trauma. And the nice piece is it allows us to partner with our senior centers where many folks are helping us to make those blankets. So it's a real community effort to be doing that. And we've also partnered with Lowell Police, Fire Department, Trinity Ambulance, and Mental Health Associates of Greater Lowell to create Project Care, which provides 24 hours, 7-day-a-week trauma services for children who may experience some type of trauma, and that's activated by our police and fire departments or other first responders. Early data shows clearly that that kind of response helps to lessen trauma, keep kids from falling into the cycle of substance use, and have a better outcome. And our focus on data has been recognized with some funding in this year's state budget put together by State Senator Jamie Eldridge, which has allowed us to partner with the not-for-profit Americans Institute for Research to conduct a holistic study of the opioid services being provided across Middlesex County. Middlesex County is uniquely positioned to really be a social laboratory because of its 54 cities and towns, which represent really every possible demographic: rural, urban, suburban. It also builds upon, this study will build upon our existing partnerships with healthcare, mental health professionals, as well as obviously our first responders. The goal of the project is to look at the complexity of the problem and leverage effective and sustainable solutions by looking at health and human services data. As well as what we have found to be so important is listening to the voices of those who have lived experience. It's our hope that through this look at the data, we'll be able to establish correlations that will help us to prevent future overdoses. Already, one of the trends that we have seen in Middlesex County that we are really trying to bring to the awareness of folks either struggling with addiction or those who may love them is that in 2017, 83% of our fatal overdoses took place in the person's own home, typically when the person was in their own bedroom or maybe a sleeping quarter in the basement. And of note, in 67% of those, there was another person not using who was present in the home, either at the time of or just prior to the overdose. So tracking and understanding that, we hope, will give folks the opportunity to take preventive measures to make sure they know CPR, they have Narcan in the house, and they are checking on people, even when they might be breathing a sigh of relief, that their son or daughter is safely in the house at night. And I'm very pleased to be joined today by several important community partners who've been working with us to address this epidemic. Beginning at my far left is Chief Jeffrey Winward, the chief of the Lowell Fire Department, who has been an amazing partner to us, representing really the new trend in fire services as they've become a piece of this. In the middle, I'm joined by Chief Joseph O'Connor, the Chief of the Concord Police Department, and as always represents the best of the partnerships that we have with law enforcement in Middlesex County. And to my immediate left is Keriann Caccavaro, who is a case manager at Banyan Recovery. We'll talk a little bit about her experience. So beginning, if we could, with you, Chief Winward, tell us a little bit about your background and what's brought you to this piece of work.
Well, thanks for having us here today, Attorney Ryan. It's great to be here. I'm the fire chief in Lowell, and I have been the chief for about 3 years. And I worked my way up through the ranks. I've been on the department about 24 years. And, we've been involved with the opiate epidemic for a long time in the city of Lowell, and we've got a lot of great programs. We're trying to attack the problem from many different angles through education and through Narcan use. All the public safety agencies in the city are carrying Narcan. We're carrying rescue breathing equipment, which is a very big piece in saving lives for those that are suffering from overdoses. We have a co-op program that I can talk about a little bit later. We have a public education officer that's trying to get into the high school and the middle schools to talk to young children about the perils of using illegal drugs and how it affects not only them but their entire family. So we find that attacking the problem from many different angles is making a difference and saving lives.
Thank you. And Chief O'Connor, the same. If you tell us a little bit about the Concord Police Department, what you did before that, and how you're addressing this crisis.
Sure. So I started my career a while back in 1986. I started out in a small town on Cape Cod and quickly moved to the town of Winchester here in Middlesex County. And then I had an opportunity to go over to the MBTA Transit Police, where I spent about 24 years there before becoming the chief in Concord in June of 2014, really right around the time where things were picking up in the county as far as a number of overdoses. So we've done a number of things, mostly in partnership with your office, other police departments, social service agencies, and healthcare providers. We got a grant that we have a share with the police departments in the Concord District Court, where we have a social worker who will reach out to individuals that we believe are either having substance abuse issues or mental health issues. Just recently, we were able to add a recovery coach to that team, which we're very happy about, to be able to further try to link people with services. We've really changed our mindset from trying to go out and arrest our way out of problems, but to link people with services. Also talking to different groups, seniors, young people. We have in our station, people can drop off medications out of their homes, shops and things like that, 24 hours a day. Try to remove those things, and with your office, working with realtors and so forth to educate people about people that have items in their homes. But it's really a constant thing that we're evaluating every day, trying to locate people and link them with services.
Thank you. And Keriann, tell us a little bit about what you're doing now and some of the work you've done with our office.
So I am Keriann, and I am a recovering heroin addict, currently with 3.5 years sober. I work for Banyan Treatment Center as a case manager, and you and I have been traveling Middlesex County for about 2.5 years, I want to say, just speaking on my personal experience, what I needed while I was seeking recovery and the progression of this disease. I currently am a recovery coach. I also run Arlington Overcoming Addiction. I just try to be available for anybody that's looking for advice, assistance, guidance, and basically to help open the door into recovery.
Now, Chief, you mentioned the use of Narcan, and one of the things we've been doing in our office is using our drug forfeiture funds, that is money taken, ordered by the court from drug dealers, the money they've made from that sale, and buying lots of Narcan and making that available to first responders, to universities, soup kitchens, really any place that people have experienced that. Can you talk a little bit about the difference that's made in terms of what you're seeing as outcome with use of Narcan?
Well, it's made a huge difference in the city of Lowell. All the first responders, police, fire, EMS, started carrying Narcan on every piece of apparatus about 4 years ago. And, it's made a huge difference. The public has also started to carry Narcan, and it reverses the effects of heroin. When people do use heroin, the first thing that happens is their breathing slows down, and then it stops. And the sooner they can get a dose of Narcan, the quicker that'll reverse and they'll start breathing again, which becomes a life-threatening emergency. And the Narcan, along with rescue breathing, that we've seen has made a big difference in saving lives.
And, I mentioned earlier, Chief, that the use of data has played an important role in our development of programs. And one of the most hopeful things, really, is the surge protection that we've been able to put together in Lowell that you're responsible for activating. Can you tell us a little bit about how that uses the data, what happens, and what the outcomes have been when you've activated that?
Sure. Trinity EMS in Chelmsford does the transport piece of our medical system in Lowell. And they purchased a software program called First Watch. And what it does is it kind of monitors all their run reports, and it picks out keywords like overdose and heroin. And they keep track of all the overdoses in the city and the greater Lowell area over the past 3 days. And they have a supervisor named John Kelly who analyzes that data daily. And he and I keep in touch. And we have a protocol. If we get a surge in overdoses, he'll notify me, and I'll talk with the police superintendent and the city manager. And when we all agree, we'll put out a message out to the public via traditional media, social media, all the different outreach workers in the area, all EMS workers, police, fire, and we'll try to blast out this information and give a warning to people that there's a bad batch of heroin or a mixture of heroin and fentanyl in the area. And please keep a close eye on your loved one if they are using heroin or other drugs, and check on them frequently. Please don't use alone. We find people that are alone when they're using and the people that are dying. If an overdose is witnessed and someone either administers Narcan or calls 911 right away, it makes a big difference. We can get to them quicker, we can get oxygen in their system quicker, we can get Narcan in their system quicker. Just last weekend we had a surge in Lowell, and we activated our protocol and we put out a big media blast, and it made a huge difference. We went from 20 overdoses in 3 days down to 3 overdoses in the next 4 days. So it made a tremendous difference, and it really did save lives.
And Chief O'Connor, you talked a little bit about some of the steps your department has taken, getting grants, putting recovery coaches, reaching out to the families. How are you conveying that? Has that become a part of training? How would you say, over your years of police work, the response to overdoses has changed, and how do you bring your officers into that culture?
Yeah, so it's changed dramatically, policing, the whole issue from really being focused on enforcement to really recognizing that this is a public health problem. And our officers, a lot of them know that. So it really hadn't taken that much training, so forth, but other than us discussing it and giving them tools, the Narcan, bringing in a social worker, now a recovery coach, because unfortunately, I don't really know any families that haven't been impacted by addiction. Whether it is this heroin addiction or alcohol or some other substance. So everyone is really familiar with that, and I think our officers, our community are glad that we're taking this approach and knowing that the resources are there. At least we are there, that we can offer people opportunities to get some assistance.
And Chief, you mentioned enforcement. Do you agree that really in terms of enforcement, the shift has been from, what some would consider maybe street activity to looking to stopping the influx of substantial amounts of product into our county and our cities and towns?
Right, and that's the focus. I think I'm in agreement with the chiefs around the area. People are dealing drugs. We want to bring them into the criminal justice system. If someone has an addiction problem, we want to link them to services. Try to stay with them, be a resource. Their families have resources and support. We're a very different community than Lowell, which is urban. We're suburban and rural, but we're not immune to those issues. And what the chief was talking about, and you've mentioned overdoses occurring in the home. That's where we've seen them in our community. So, having people stay with their loved ones, having the Narcan in the home. 4 years ago, when I mentioned at a community meeting that we were putting Narcan in our cruises, people really didn't understand why we were doing that. And now I think people would be asking, why don't you have it if we didn't take those steps?
And Keriann, you've been a great asset to us over the last few years, talking to people in different settings about how there are signs that they might miss or what they should be worried about. Can you tell us a little bit about what kinds of even the more subtle signs that would indicate to a family member that there's someone struggling with opioid misuse?
I think a lot of it is a lot earlier than when the person actually picks up the drugs and alcohol. So it's mental health type of symptoms, so like depression or lack of motivation, or their behavior is changing dramatically. That right there is like a first indication from what I've seen and in my own personal experience that something needs to be talked about, something needs to be looked at. But after the person ends up using alcohol or heroin, it's like not having money, not able to keep a job, dropping out of school, and then body-wise losing a lot of weight, covering up their arms in the summertime when normally they would wear tank tops, often sick. I feel as though most parents almost miss those signs because they're very common symptoms of the flu or depression, but a lot of times what it ends up being is a lot more than the mental health side of it, where it's addiction now.
Now, we talked a little bit about the programs that we've put together to deal with childhood trauma. Tell us about, both in your own experience and in the work you're doing, what you've seen of childhood trauma as being present in someone who then turns to substances.
I have yet to find somebody who hasn't had some sort of childhood trauma. It may not be the same type of trauma as I've experienced, but it's something that has changed the course of that person's life, which has brought them down this road where the only solution was picking up heroin. For myself, like something as small as my parents' divorce, which changed my entire foundation of my life at that time, then because of that, I seeked outside of attention, looking for males, looking for alcohol, hanging around kids that were not doing what I was brought up to do. Also, I could receive some sort of attention because I just wanted some sort of attention, so negative was better than no attention. A lot of times with females, domestic abuse comes into play, abuse on themselves with their body, and with males, it's more or less like internally, staying to themselves, not growing to the extent that they possibly could, and even bullying. Bullying could. A lot of kids now are coming and saying that like the way things happen in school, how they were treated in school led them to their drug addiction. Their home life was perfect, but what happened in school guided them down to picking up heroin.
Chief O'Connor, talking about how, as Keriann said, there might be behavior that's going on before somebody gets to a substance abuse. Can you talk a little bit about some of the things that Concord Police Department's doing in terms of looking at what might be seemingly low-level offenses, like a theft or some kind of mischief, and really using that as an opportunity to intervene? Yeah,
so particularly with young people, our school resource officer who also does juvenile work, and our other officers, we try to look at every single case that comes in, and particularly with people that are in our community, we get to know their families, and if we have any type of hint that there is some type of mental health issue, or looking at what caused that person to whether it was doing a shoplifting or even in some cases driving erratically after we've been at a house for a domestic dispute or something like that, to try to really interject ourselves into that, whether it's with school guidance counselors and counselors or with the social worker that we have, reaching out to that family and trying to link them to services if needed. A lot of times it's really changed having a social worker than a police officer going to the door. When we go together, it's really, we've been able to open up communications with families. And our officers, who have been on the department for some time, we know families that have, sometimes it's generational, where dad was having an issue or mom, and then now they have children, and those children are having it, and we try to break some of those cycles that exist.
Now, Keriann, you mentioned that a parent might maybe be almost oblivious to some of those signs, or see them and maybe just write them off to something else. They're stressed about school, it's the flu. If you're seeing those kind of things, what do you recommend in terms of how a parent approaches their children about something they suspect?
just opening it up with communication. Is everything okay? How are you doing? How's school? A lot of the times, from my own personal experience, like with my parents, is their main concern was like providing. So providing a roof over the head, being able to provide clothing and food and everything. But at times what was needed was just like communication. Is everything okay? What's going on with you? How are you feeling about this? And having that like trust where the child's not going to feel that the parent's going to be disappointed. So it's a trusting conversation. If not, therapy. Therapy a lot of time will help, not with extracurricular activities. So sometimes sports or anything that can just open up the gates of communication.
Chief Winward, you talked a little bit about how the department's been using Narcan, that life-saving drug. And how is that, what effect has that had on the men and women in your departments of being in that situation so often, having the opportunity really to save lives? Has that made a difference? Are you communicating something differently in training and how they're responding with families?
Yeah, it can be a very stressful thing for firefighters, and just about every one of my firefighters has been affected in one way or another in their family. And we also have a firefighter that participates in our co-op team, and he goes out and he follows up on people that are suffering from addiction, and that when they overdose, he'll go out and talk to them and try to steer them into the right program. He'll keep trying over and over again, and it becomes difficult work. It gets very stressful. We worry about needle sticks. There's a lot of needles around in some of the wooded areas. But the firefighters have embraced it. We train on administering Narcan regularly. We train on CPR and rescue breathing. So it's something that's part of our job, and the firefighters have embraced it, and they do realize that they're saving lives, and it is a critical part of our job today.
Now, Chief, you mentioned some of the things you've been doing to dispose of medication, and we know that about 70% of the prescription medications that are misused come out of someone's medicine cabinet. Can you talk a little bit just about the importance of people really doing that simple thing? When people say, what can they do? That is a free, simple thing that people can do, getting the medication out of their house.
Yeah, and most of the police departments, I think, in the county have, with your assistance and others, we have drop boxes where people can come into the lobby 24 hours a day and drop those medications off at any time. And the other thing I think is really important, important point, is when you're having surgery, talk to your doctor about medication. If you have people with substance abuse issues in your family, let the doctor know that, because people could be prone to that as well, and medical providers should be aware of that when people are going for surgical procedures and things like that.
Being a good advocate for your kids if they're the patient.
Absolutely.
In terms of that. Now, Chief, we've talked a lot about Narcan. Is Narcan something that's easily administered by someone in the public?
It is. There's plenty of training out there. I know Trinity Ambulance has been training some of the fast food restaurant owners in our community and some of the business owners. It's very simple to use. There's two different versions of it in the area right now. There's a 2 milligram version that's a little bit more complicated. You have to put the unit together. But there's a new version that's a 4 milligram version, and it's one step. You just take it out of the package and put it in the person's nostril and squirt it in. And a lot of times they'll wake up and start breathing again 5 to 10 minutes later.
And you brought Annie with you today and a dose of Narcan. I'd
did.
like to invite Chief Winward at this point just to demonstrate how easy it is to administer that.
Sure. If we arrive at a medical emergency and we think the person may have overdosed, we'll take a look at the scene, size up the scene, and see if there's any drug paraphernalia around. Talk to any bystanders and ask what they've noticed. Is the person a known drug user? And we'll go up and check the person and see if they're conscious. And this person's unconscious. So the next thing we would do is open the eyelid and check the eyes. People that have used heroin often have pinpoint pupils, and that's a very big sign that they have overdosed. And we'll check their breathing rate. The respiratory rate for an adult is normally 12 to 20 breaths per minute. And when people do take heroin or fentanyl, their breathing rate slows way down and then it stops. And when a person gets into that state, it's life-threatening. So if you give the person a dose of Narcan, it'll reverse the effects of the opiate, and a lot of times they'll start breathing again on their own. So we take this syringe that has the Narcan in it, and we put this atomizer on the end, and it kind of turns a straight stream into a mist. And we go up to the victim, we place the atomizer into the nostril, and we squeeze about half the dose into one nostril, and then we go to the other nostril, and we push the rest of the dose into that nostril. And if EMTs or firefighters or police are on scene, they'll often start rescue breathing for the person with a bag that's hooked up to oxygen. The first thing they need is oxygen, and it'll take a few minutes for the Narcan to take effect, so we'll breathe for them for the next 3 to 5 minutes. And then usually after about 5 minutes, a lot of people will start to wake up. They'll start to breathe on their own. Their breathing will come back to normal. They'll often turn blue. The color will come back to them when they start getting oxygen, and hopefully they'll wake up. If after about 5 minutes of rescue breathing, we don't see them wake up, we'll give them a second dose and sometimes a third dose. And as long as they have a pulse, normally 1 to 2 doses of Narcan, along with rescue breathing, will bring the person back.
As the strength of what's on the street, particularly the use of fentanyl, has increased, Chief, have you seen the need to use more and more Narcan to revive
Absolutely.
somebody?
We're seeing sometimes 2, 3, even 4 doses before someone will wake up because of the widespread use of fentanyl nowadays.
Of the 4 milligram doses?
We've switched from this 2 milligram dose up to a 4 milligram dose. We're finding we're using a little bit less. But as the drug gets stronger and stronger, we're using higher and higher doses, more doses, and as well as longer rescue breathing. But through all the hard work of the police, fire, and EMTs, we're finding that we're saving more people today than we were just a couple of years ago.
Thank you. Thank you. Unfortunately, we are out of time. I'd like to thank my guests today, Chiefs Winward, Chief O'Connor, Keriann Caccavaro, and thank you again for watching. I look forward to seeing you on future episodes of Middlesex Update.